Hi, it's Giri Srinivasan, your physiotherapist from Edmonton, Alberta. Today we're going to talk about neck pain and headaches. That's the whole point of today's virtual workshop. Okay, let's get into the slides. Hope everybody's comfortable out there. Okay, why neck pain? Why headaches? Because last month we did lower back pain and sciatic pain. It was very well done, and then people have really appreciated well, and a lot of people took a lot of good points out of that. So the next common thing we see in our clinics is neck pain, right? And we're going to discuss that and give some important tips for the community to see how they can help themselves and understand, educate, and empower them. That's the whole point of this one. Okay, I'm Giri Srinivasan, registered physical therapist with College of Physical Therapists of Alberta. I've been practicing for the last 22 years and treated over more than 14 to 16,000 patients. Maybe I would say 30% of that would be neck pain population here. And we have done several post-graduation courses after our bachelor's program and a lot of advanced panel courses and everything. We keep learning all the time, and that's how we have done. So let's get into the slides right away. Very common, 2 out of 3 people experience neck pain in their lifetime, okay? And it's very high among the working age population. People who sit on the desk all day, and people who are working, construction workers, and even dentists, who bend down all the time to work on your teeth, and carpenters. So you take a lot of different professions. It's very, very common condition to have neck pain. And general population, they're saying 10 to 20%. And 25 to 40% of the people who has neck pain, they also complain about referred pain into the arm. We call that cervical radiculopathy. Okay. Next slide. Classification. I'm not going to go into much details about a lot of medical jargons here. I'm going to be very simple in classifying the neck pain into 2 categories. First is the pain coming from your muscles, joints, and ligaments, okay, from the neck. That one category. The other category is coming from the cervical nerve roots, nerves, and the spinal cord. So we're going to classify into 2 simple categories like that. Next, the normal range of motion in the neck, you got about 80 degrees of flexion, about 50 degrees of extension, 45 degrees of side flexion, and about 80 degrees of rotation on both sides. So that's a normal range. If anybody is wondering what are the movements and the range of the neck is. So when you examine a patient who comes into the clinic with the neck pain, we kind of see whether they have mechanical problems or kind of inflammatory or any other worse problems like neoplastic, other cancerous, tumorous problems. How do you differentiate that when you examine? So when you have a mechanical problem, you'll have asymmetric limitation in the movement. That means one side will be much more affected than the other side. These kind of people, usually we see them, they come to the clinic, I woke up in the morning, I can't turn my neck to the right side, it's limited here. Those kind of people you see, this mechanical problem. They either really stiffen one of the joint or they strain some muscle in that area. We call them a mechanical neck pain. The other inflammatory and the neoplastic disorders, they'll have mostly widespread pain in that area and more or less very symmetrical presentation. Movement will be affected in most of the directions symmetrically. So now we have to look at how we're going to differentiate the source of neck pain, whether it's coming from the joints, ligaments, or muscles, or it's coming from the nerve. How we differentiate that? If you have pain from the joints and the muscles of the neck, you're going to have these symptoms, what you see on the slide here. People complain about pain and stiffness, obviously, very dull aching pain and episodic pain. So they don't get it all the time, but certain instances they'll get the pain. And also awkward posture. And also there's no history of injury. They would have not fallen down or any sports injuries. It just comes on out of the blues, right? And then asymmetric pain, we already talked about it, one side more than the other. And sometimes when you have problems in the upper neck, it can refer into the head also. And sometimes lower cervical pain or the lower neck pain can go into the arm also. Referred pain is also common in this. And you don't have to have the nerve impingement for that. Sometimes you can get referred pain from mechanical issues as well. And this one mostly aggravated by the movement and relieved by rest. Pain from the nerve roots and spinal cord, how that will be? That's going to be excruciating pain. Yeah, that's going to be very sharp and intense burning pain. You're going to have it. Okay, it can radiate, depends on which nerve root is irritated. It can radiate to even in your shoulder blade area, in the lower neck area. It can go into the arm. A lot of people say the deltoid area, that pain in the shoulder area. It's not sometimes shoulder problems. We have to do proper examination to find out whether the pain here is coming from the shoulder or it's coming from the neck, right? And also, when the compression is too much, sometimes you can get muscle weakness in the hands also. So usually the numbness and tingling is kind of the first warning sign when the nerve is not happy. It's trying to tell you, hey, I'm not happy, you're putting too much pressure on me, whatever you're doing, it's not helping me, right? Then we have to address it at that stage, at the numbness tingling stage. Otherwise, it's going to go into the pain stage, and then it's going to have a burning, very excruciating pain after that. If you don't take care of that also, then you're going to end up in muscle weakness. The more compression it is, you're going to get muscle weakness in the group of muscles which that particular nerve supplies, okay? We call them myotomal distribution. So we can easily check and identify, by checking your muscle strength, we identify which nerve root are most likely to be nulled, right? And also these people may also get upper cervical spine nerve root compression, which can give you headaches. We call hospital headaches as well. And we're going to talk about headaches later in the presentation. And they can have the nerve root irritation referring pain into the scalp in the back as well. Most of these people, they'll have little aggravation of pain by extension, hyperextension of the neck. It will be very hard for them to do. I've been talking about extension when we do examination in the clinic here. When I ask people to look up, a lot of people, first thing they do is just roll their eyes up, okay? A lot of people don't even look up anymore. Just imagine, when is the last time you actually did a full extension like this, right? Without leaning back too much. It's very hard because we don't do that activity anymore, and such an important movement, and we have so many muscles for that extension movement. So if you're working in the office, sitting at home and working, make sure you at least extend and look up the ceiling nicely, your nose parallel to the ceiling, at least 5-10 times in a day. Get those joints moving in that range. That's very, very important. And differential diagnosis. So what are the different conditions neck can have, and we differentially diagnose that from one in each other in different ways, right? Tension neck, too much muscle tension in the neck, right? We did a video for the text neck syndrome recently, and we posted in our Facebook page for our InStep Physical Therapy. You guys can check it out. What is text neck syndrome and how we can prevent it? What are the exercises you can do? Some valuable information in our YouTube channel and also our Facebook. You can check it out. Torticollis. Torticollis is, in layman term, wry neck or side tilting of the head to one side. Because I'm also a pediatric physical therapist, I see a lot of babies with congenital torticollis. That means they're born with neck in the side a little bit because of the small space in the uterus and because of the other reasons. I treat a lot of babies as well for that condition with moms. I'll teach the mom how to take care of it, and we can go from there. And that because that will alter the head shape for the babies as well. And for adults also, they can develop torticollis by sleeping wrong, and you get up and then you strain the muscle and you come to the clinic like this, right? So that's called torticollis, side bending of the neck. Fibromyalgia, it's a very common times we hear that from the patients. Myofascial pain syndromes, because you have so many muscles in the back of the neck, in the side of the neck, and so much facial connections coming from the cranium all the way to the back, the superficial back line, superficial front line, everything is there, and fascia can get tighter here, because these fascia here, they connect to your pectoralis fascia on both sides, your sternum, and also the fascia from the back goes into your shoulder blade all the way down to the lower back. We have so much regional interdependence from the neck to the other parts of the body. We're going to talk about that later. So you can have myofascial pain syndromes as well. And cervical spondylosis, what is that? It's basically wear and tear of the cartilage and the joint surfaces. As you age, you're going to get it. Sometimes you can call it arthritis too, right? It's not a disease, as we discussed before. It's just an aging process, right? And we can't reverse those changes, but you can do certain things to kind of make it work for you. Live symptom-free and healthy, happy lifestyle, okay? And cervical IVDP means intervertebral disc prolapse. Okay, that's common in certain injuries and traumatic conditions. Sometimes wear and tear of the disc outer layers can protrude the disc outside as well. That can be very painful in the neck. It doesn't matter in the back also. It can be very painful. Sharp shooting pains into the segments where it's compromised. We have differentially diagnosed that as well. And whiplash. Whiplash is very common in car accidents. We see quite a bit of car accidents patients with whiplash. We're going to little detail later in the slides here about whiplash. And also in sports injuries also you can get whiplash, and fractures, dislocations, ligament injuries to the neck. It can be very serious. We have to be assessed properly and then make appropriate referrals with other healthcare practitioners to deal with this condition. And concussion too, kind of concussion and whiplash can come together in sports injuries and car accidents too. We see so many combinations of that in car accidents patients and sports injury patients. As a concussion therapist, we also manage concussion along with the whiplash, because concussion again is another big topic. I'm planning to do a virtual workshop on concussion very soon, so we'll talk more about it at that time. Myelopathy, that means sometimes your spinal cord is compromised. It can be a disc pushing on the spinal cord, it can be other injuries or trauma putting the pressure on the spinal cord. You get a lot of neurological symptoms on both sides of the arm, sometimes even the legs as well. Right? Cervical stenosis, again, stenosis means narrowing of the canal. It can put pressure on your nerves and then it can cause symptoms, referred symptoms. Osteoarthritis, we already talked about in your facet joints with the joints of the neck, right? So, we always talk about this slide here. What are the common mistakes people do when they have neck pain or headaches? A lot of times they ignore it. They keep on going with it because life is too busy, right? Right. I think we are living in the most comfortable time or time period in the whole planet right now. We fix everything outside to our comfort, right? But how much are we fixing inside for our well-being? That's a big question mark. And that's what we have to focus on, right? And not ignoring it. So a lot of people, they ignore it. And some group of people, they try to alter it. They try to alter it by taking pain medications or going for some injections or even surgeries. Neck surgeries is not very common like lower back because it can be complications quite too high, and you have to kind of weigh the risk versus benefit. So yeah, you have to think about it, how you're altering it and what is the point of altering it without working on the cause of your neck pain. Some group of people, they're really good and they try to fix it by consulting the healthcare practitioners. They go to the physician, they go to the physiotherapist, a chiropractor, or whoever they believe who can help them. They're going to go take their help and then get into the cause of the problem and then try to fix it by doing whatever it takes, manual therapy or exercises or postural education or postural retraining or ergonomics, whatever it takes, they will fix it. We love those group. Hope everybody is doing so far. I'm going to take a sip of my coffee here. Okay. Let's go on to the whiplash. Okay, whiplash, I told you, it's like this, that movement. That's why we call it a whiplash, right? So this is what happens to your head, right? What happens? There are two types, as you see in the slide here. Hyperextension injury, right? When somebody hits you from the back, your head goes, I show it in the side, somebody hits you from the back, your head goes like that. It hyperextends and come back, right? That's what we call hyperextension injury. It's also called as acceleration injury, okay? If somebody hits you from the front, right? If somebody hits you from the front, you go for that hyperflexion injury. That's your deceleration injury, they call it. The patterns and the symptoms can be a little bit different in this. We don't have to go much into detail of that. I just want you to know what are the two different classifications for that whiplash. A small picture diagram you can see in the slide there. You can see in the hyperextension how much compression, where the compression is happening, how the head is going to back. Sometimes if this force is too high, don't forget, think about the brain inside that cranium too. The brain is also going back and hitting against the back wall of the skull when you're doing the hyperextension. And it's kind of, the brain does the same thing. I tell the analogy to my patients like, imagine an egg floating in a glass of, or a bowl of water or a glass of water, right? Shake the glass and see what happens to the egg. It goes, hits the walls of the glass in the water. That's the same thing happens to your brain. Your brain, the actual living brain, is floating. It's floating inside the cranium, right? And it goes, hits against those walls, and that's what concussion is. That's why whiplash and concussion most of the times go hand in hand. As a physical therapist, we have to do thorough examination and identify those symptoms and treat accordingly. Headaches, dizziness, problems with the gaze stability, reading, kind of too much kind of problems with audio and visual stimulus. There's so much concussion symptoms you got to take care of. Disc pathology. It's just a small picture to show you the angry disc, and you see that you can appreciate how close the nerves are to the disc, so that when the discs have a problem, they can put the pressure on the nerve and cause you some troubles there. Spondylitis, you can see the changes happening in the vertebra. We call it the spurring or lipping of the vertebra. As we age, the kind of degenerative changes happens there. And also you can see the disc height kind of going down on that one, right? Those are things happens when you have osteoarthritic changes or spondylitis changes. This is a very common thing you can see with people after 45, 50 years, right? Facet joint dysfunction. What are the facet joints? Every vertebrae has two joints on both sides. Those are the facet joints. Sometimes that joints are not moving very well for some reasons. And also strain of the muscles around them. There is so many layers of the muscles in your neck. It's kind of layer by layer, starting from the small muscles on the top of the neck between the cranium and the top two vertebrae. They are more like a very, very sensitive structures with a lot of sensors in them. They are informing your brain and your eyes. They're coordinating with them to balance yourself. And also we call it proprioception, which is joint position sense. It helps for the brain to calibrate how your head moves in space, right? We have other vestibular apparatus in the ears too. They kind of work with them as well. Just for you to kind of know how your eyes and the upper neck is connected, very simple thing you can do. Put your hand on just below the scalp or skull on the top of the neck there. Gently touch that and then try to move both your eyeballs to the right and to the left. To the right and to the left. And see what you feel under your fingers. You can feel the muscle contraction happening under your fingers. Why would it contract? You're not moving your neck, you're just only moving your eyes. That will help you to understand the connection between your eyes and your neck as well. It's a small thing. Okay, so when you strain your muscles, the neck muscles there, you can have a lot of pain as well. Then we have to work to heal the tissue and retrain the tissue and then load the tissue and get you going with your active functional activities. And that's what we do anyway for a living. Postural issues. This is the big issues when it comes to the neck, right? See, in the COVID situations now, how many people are sitting at home and working from home in the office? So many people are working with laptops. Laptops are worse than the desktops because it makes you bend your neck more unless you have a laptop tray to raise it up so that your top of the screen is at the eye level. That would be the ideal thing to do. If you haven't invested in a laptop tray, you should, because that $100 investment is the best investment you can make for your neck. I always advise my patients that. Here you can see the slide to just give you a small example. A lot of people don't know this, to know how heavy is your head, right? You see the first slide, normally when your head is on top of the shoulder, you say it's 12 pounds, okay? So if your head is moving 2 inches forward, see how much the weight is changing. It's almost 32 pounds. Your head weighs 32 pounds if you move 2 inches forward. So that puts so much pressure and so much on these muscles. They have to work way too harder to maintain your head stable on your shoulders. And if you move about 3 inches forward, see, it's 42 pounds. Do we need that? So normally a person in the cell phone, when he works on the cell phone, you sit on the chair, work on the cell phone, this is how the neck is. That's actually more than 4 inches. So that's how much weight increase happening, how much more your muscles has to work in the neck. What kind of abuse is that? That's the worst abuse you can ever do for your neck muscles. So if you have to work like this, you have to bring it up. We'll discuss more of that. Bring it up here for your cell phone and also your other works at home as well. This gives you an idea how important the head position on the shoulder is to maintain your integrity of the neck and the efficiency of the neck muscles working. Here I can show you some of the checklists for the posture you see. I was just talking about the cell phone use, how to use the cell phone, how to use the iPad or the laptop. Laptop and iPads are the killers, guys. You have to change the position, put a pillow or something underneath, or use a laptop tray, right? So those are the very important tips. If you follow, it goes a long way. Not only you, your kids also. Nowadays, kids are home doing online learning. They're spending so much time on their electronics devices, and plus there are other video games and other things. It's very hard for them to maintain good posture. As parents, it's our job to educate them about their posture and also give them appropriate tools to work on it and reinforce positive behaviors so that they can grow up to be having a good healthy necks and a healthy spine as an adults. Because otherwise they're all going down the road. They're going to have a lot of problems. You're going to have a big epidemic of neck pain people in the next 5 to 10 years, all these kids growing up. So we don't want to go there. Your neck and jaw. A lot of people also have jaw issues. People say, I have TMJ. Yeah, everybody has TMJ. TMJ is a temporomandibular joint. So you have two temporomandibular joints, which helps in the movement of the jaw. That is very much connected to your upper neck, biomechanically and also muscular and facial connections. So if you have jaw issues, that can also affect your upper neck. And it goes vice versa. If you have upper neck issues, that can cause jaw pain as well. So I also work with a lot of dentists to work on the TMJ disorders. I've done my mini residency with Minnesota College of Dental Sciences just to work on the TMJ. So we focus on that as well. So if you have problems here, don't put it too much delay to get help there. That's very important to take care of that as well. And also not only jaw, your tongue, your eyes, they are all very much connected to the neck. With Moshe Feldenkrais in his approach, he has treatment approaches for the neck pain just by using the eyeball movements, tongue movements, and the jaw movements. I actually worked like that with some of the patients, really worked very well. People who have really acute neck pain, without even touching their neck, just with their eyeball movements, tongue movements, and the jaw movements, we got the pain reduced and movement improved. You believe it or not, okay? Your neck and shoulders, another big link out there. A lot of shoulder pains, upper back pains come from the neck because we have so much myofascial connection and biomechanical connection, right? So many muscles coming from your neck all the way to the shoulder blade, and also your muscles which is connecting shoulder blade to the thoracic spine, which is the upper back spine. They are also part of the neck mechanisms. So a lot of times your shoulders have to follow where the head and neck goes. If you have forward head posture, the shoulder has to go forward. You cannot go anywhere else. So that brings your arm bone, which is humerus, forward and rotated internally, and causing your tendons to impinge and causing shortening of the muscles in the front and other biomechanical dysfunctions of the shoulder. It also affects how your shoulder blade moves. That's going to expose your tendon for impingement. Then you're going to end up in a lot of shoulder issues as well. Your neck and neurodevelopmental sequences. Because I'm also a neurological therapist, I'm also a neurodevelopmental therapist. I did my post-graduation in neurodevelopmental therapy in Bobath approach for treating kids and adults with the neurological disabilities. Neck is a starting point, right? Imagine when you're a baby, right? So the first thing you get is your neck control, right? We are all born with primary curves, and neck curve you develop is a secondary curve. It develops when you first in the baby on the tummy, when the baby is trying to look up. That is when you develop the curve in the neck. That's why it's called a secondary curve. And there's a lot of writing reactions from the neck. We call them neck writing reactions, which is very important for the baby to develop control and also develop the rolling on both sides and coming on the tummy, coming onto the hands. And a lot of the developmental patterns all starts from the neck. So the same sequences we use in our interventions sometimes. Sometimes when you have people with neck pain and back pain and shoulder pain, some of my treatment plan includes rolling. And there are a lot of components, even for adults, it will miss in rolling. We can go back and correct it. I've made people crawl for the problems as well. So just want to give you a glimpse of idea about how we use neurodevelopmental sequences in treating for orthopedic interventions. You can't actually separate orthopedics and neurology when it comes to treatment. They blend together. There is no orthopedics without neurology. There is no neurology without orthopedics, right? So I want you guys to connect those things together to identify and to work with it. And headaches. The International Headache Society has classified headaches into two things, right? Primary and secondary. Primary headache, that means the headache is the diagnosis. There is no other diagnosis. For example, migraines and tension headaches. The secondary headaches, there is an underlying cause or underlying condition which is causing the headache. Those headaches are called secondary headaches. So that's why the cervicalgenic headaches or spondylogenic headaches are secondary headaches, because they are caused by something else. right? It can be from the nerve, it can be from the muscles in the neck. So that's why they call secondary headaches. So cervicalgenic headaches means headaches originating from the neck. It can have different patterns. It can be due to the trigger points. In the first picture, you can see all those X. The X are the trigger points. That shows the sternocleidomastoid muscle, which is coming from the collarbone to the back of the ear here. The trigger points in them can give you the headaches in the spots where you see red spots here. So that's a referred area. And trigger points can give you headaches as well. Sometimes you have severe joint stiffness, or the muscle stiffness can give you the headaches as well. So those type of headaches, we have some criteria to identify what kind of headache it is. I'm not going to depth of that one yet, because we have migraines, you have tension headaches, you have cervicalgenic or spondylogenic headaches, you have headaches from from Whiplash. It's a little different. So there are different classifications. We do a lot of differential diagnosis to identify and treat accordingly. Just want to give you an idea that your neck can give you also headaches. That's very important. That's why when you tire your neck muscles too much, when you tire your neck too much, you can get severe headaches as well. And we can treat that efficiently. X-rays and MRIs, we always emphasize this all the time. When you take X-ray, when it shows something, some degeneration here, that's okay. That's totally fine. Because 80% of the people who has disc bulge or something like that, they live without any symptoms at all, right? So when you see something in MRI, don't get alarmed. Talk to your healthcare practitioner, talk to your therapist, talk to your chiropractor, and talk to them, because nothing like, oh, it's life-ending, right? So it can be looking always little worse in the radiological finding than what it is normally, right? And we're going to talk about that a little bit. So don't worry about it. And also the joints are there, they don't go out anywhere. Sometimes they can be stiff, we just have to mobilize to get them moving, right? So that's what it is. Pain 101, a small glimpse, right? Because as I said, what we know about pain science, pain neuroscience now is much better, and it's much different than what we knew when we studied in the college 22 years ago, or what we knew from before, right? We're going to talk a little bit about that. So you see the picture of Descartes there, and the concept of pain pathway he described before. This is the old picture from 1664. Figure that out, eh? In this, it suggests, if you see, the pain fibers send pain signals to the pain center in the brain. So that was the thinking pattern. That's not actually true. Yeah, modern science have actually disproven that theory. Although many people still think the old theory is good, it's not like that. I want you guys to really understand this. We have only danger pathways, right? We don't have any pain pathways, and the brain has to get inputs from so many different systems and receptors to kind of weigh it up and see, is it even relevant or not relevant? Should I give him pain or not pain? So pain is an output from the brain, right? It's not always, don't think it's only from the input of the damaged tissue. That's a very important take-home message for you guys. Pain also is just a predictive alarm. It's not a damage detector. What I'm trying to mean here is the amount of pain you have is not directly proportional to the amount of damage you have in your tissues. It can be any tissues in your body. Okay, there's a lot of other factors going to play an important role in deciding how much pain you're going to feel. Understanding pain and how to treat it is your first step to live well again. That is why we take so much pride and so much time to explain the pain neuroscience to our patients for every visit, during the assessment when they come in. Okay, you have to understand that. Then you can really appreciate it and you can work towards it to get better at it. I always put the slide on and during my presentation, the right advice is your best pain medicine. And another coping strategy is pacing. If you have, especially for people with chronic pain, some people have neck pain for a long time. They had it for 20, 30 years and they want to change it in one visit or two visits. No, it's going to take some time, right, to go through the process, and we're going to put you through the process. Going through the process takes time, and then you have to change the way you do things, the posture, the pacing, and also modifications of things and exercises to get better. Pacing is the very simplest solution we can recommend for chronic pain patients, right? And sometimes there are a lot of easier solutions, but they are the hardest one to do. Pacing is not only just to reduce the pain, but also it helps people kind of to do more what they want to do. If you do gardening or if you're golfing, you can do it. But talk to your therapist to identify what you need to do to pace your activity. So, what are the actions you need to take to make sure the pacing is work for you? You see the slide there. You have to keep doing things what you love to do, but you have to take a lot of small breaks, right? And break down your task into smaller components and do those small components and enjoy your progress at each step of the way. Sometimes we are very bad in giving ourselves credits. Give yourself credit when you achieve that small task and then go to the next task, right? So the small progress makes a lot of difference and we have to appreciate ourselves, right? Remember your perfection, right? Very often we don't. Please remember your perfection. Remember how perfect you are in so many ways. Focus on that. You will definitely go to the next step, right? Gradually increase your level of activity, right? And your physiotherapist can help you with that. And compare it with your previous days and previous weeks. Oh, last week I couldn't do that. I couldn't lift a 20-pound bag, grocery bag. Today I can. Wow, that's a great improvement. I should keep moving forward. That's a message you're telling yourself, you're telling your brain, so that they can think positively and then go to the next step and small steps. Treatment options: when you have neck pain, headaches, cervicalgenic headaches, radiating pain, all these problems you have, your physiotherapist will sit down with you, take good subjective history, good objective assessment. We don't just look at the neck, we look at the whole body, head to toe assessment to see what factors is affecting you. Sometimes your head will go forward if your feet is not positioned properly, if your pelvis is tilted too much, or you have too much compensation from the lower back. So sometimes head moves or position depends on how the base is, how the feet, how the foundation, the pelvis is. So we got to take care of everything. We can't just blame the neck for everything. That's why head to toe assessment is important. And find out the deficiencies, dysfunctions, movement pattern dysfunctions, or what is missing, what's the missing link in your body. Identify that missing links and then educate you and explain to you along with the pain neuroscience and put a plan together which is agreeable to you to reach to the functional goal which you want to achieve. You will be the prime driver of the treatment plan. That can include various things, various evidence-based treatment approaches, from manual therapy to taping, exercises on top of the list, modalities as needed, anything is it. And exercises, home exercise, always patient goes home with home exercises. And also it's graded, it's progressive exercises. It's not you get 4 exercises to do for the whole time. No, we will be keep moving you every week or every 2 weeks to the next level. So we want to take you to the finish line and reach the functional goal, what you want to desire. So the exercise program are individualized to you. You can't go to Dr. Google or YouTube to just take a couple of exercises and do it for yourself, because everybody neck pain problem is different. Everybody pain can be in the neck, but why you are getting the pain can be a different reason. And we have to assess and treat accordingly. That's why you have so many different treatment options, all evidence-based. So, since you took time to watch this webinar, our workshop, neck pain headaches workshop, if you have a neck pain or headache issue, then you don't know what to do, you're lost, you want to talk to someone, you want to consult someone to ask what's going on, what's the right steps, and we can get you a free discovery visit. You can call the number there, 780-454-5432 to InStep Physical Therapy to kind of schedule a free discovery examination with your physiotherapist. You come in, no obligation, you come in, sit down with the therapist, talk about it and see what will be the right option for you, right? And we can do that for you. And also you can email at info@instepphysio.ca as well to schedule your discovery visit. Then our office manager will call you to schedule that. If you have any questions, let me know. You can post your questions down in the chat column or the messenger column. We will get back to you on that. And thank you so much for your time for this workshop, neck pain and headaches. Next month we'll come up with some interesting topics and educate and empower you guys. Take care. Have a good one. Bye.